Hey guys, it's Amy. It's Wednesday. This is day 2 of my blog. Excited to see everybody, and thanks for the comments last week. They were super positive, and so you can check me out on my YouTube channel, which is No Sight, No Limits, all one word. And things have been a little rough this week. As you guys know, I've had a few surgeries because my retina keeps detaching in my right eye. Unfortunately, the first surgery didn't take. My retina tore in half. They repaired it, and then 5 weeks later it detached, and then they repaired it, and now it's detached again. Unfortunately, I have no vision in my right eye except for I can see a little bit of light. I can't see hand movement or can't tell how many fingers, or it's just gone. But I have a little bit of vision in my left eye, as you guys know, and so we're fighting really hard to make that as optimized as possible. So making sure that I've got a really good glass prescription. So I went in to see the optometrist today to make sure that we're maximizing that vision. I have to go on a Restasis because my eye is so dry from all the surgeries that I've had. My tear ducts don't work anymore. And also that's part of my disease, is that it causes inflammation, and inflammation stops the tear ducts from working. So my right eye has detached again, and so the plan is now to go back in about 3 or 4 weeks and remove part of my retina, because at this point I don't have any usable vision towards my nose here. It's completely black in that area. And that seems to be the problem area that keeps lifting and falling off the back of the eye. So they're going to do a pretty drastic surgery. It's called a retinectomy, and it's kind of a last-ditch effort. They're actually going to remove part of my retina, and luckily for me, it's the part that isn't functioning. So I should be okay after the surgery. It shouldn't affect my central vision, but as you can see, I've had lots of complications, so nothing is guaranteed. The hope is that I can get back some shapes or color in that eye, but it's kind of a wait and see thing, and see how my body heals. I tend to scar, and the scarring causes puckering of the retina, and the shrinking pulls on the scar, and then the whole retina gets pulled by the scar off the eye. So super not fun. Had a chance to see the rheumatologist today. My rheumatoid arthritis is out of remission, so unfortunately the drugs that I'm taking, Humira and methotrexate and Enbrel, are no longer working well enough for me. I've been in a lot of pain and sleeping pretty much nonstop for the past 5 days. I got a couple swims in there to just try to get moving. But yeah, I'm pretty uncomfortable. So I prefer not to take pain meds. So the plan is to start an infusion every 6 weeks at the hospital of Remicade, where it's a anti-TNF drug, and it's called anti-tumor necrosis factor drug, and that stops my immune system from attacking my joints and my eyes. So the hope is that it will slow things down, make me a lot more comfortable, so I can get back to running and biking like I like to, and not sleeping all day because I'm pretty exhausted, and there's only so much caffeine you can drink. So anyway, Bombay's doing great. She had her work cut out for her. We had to walk all over the Scripps campus today and UCSD, and she's getting used to my lesser vision, and she's adapting really, really well and doing such a great job. So I'm really blessed to have her. My advice to you guys this week is make sure you ask your doctors lots of questions, and make sure they understand that if you're an active person already, that you want to remain active even while you're going through surgeries, and make sure there's always something you can do, whether it's chair yoga, whether it's stretching or using elastic bands. If you're banned as far as lifting weights and things like that, there's things that you can do without bending over. There's aqua jogging, which I hate, but I do it when I can't run on dry land. So there's a lot of good options for you. If you can't exercise in your normal way, just find a different way to skin a cat, right? Because I believe movement is medicine, not only for our bodies, but also for our mental health. If I took 3 days off of doing any exercise, I'm pretty much a basket case. So I have my sports psychologist on speed dial. So that's about it. I will talk to you guys soon. Last thing I want to mention is that a lot of you know that I struggled with eating disorder surrounding the Tokyo Paralympic Games. That has been a challenge for me lately, just because I'm just not exercising like I normally do at the 3 or 4 hours a day. I'm maybe getting a half hour to 1 hour a day right now. And that makes me kind of panic as far as food indirectly. So thank goodness for a good dietitian, a good psychiatrist, and a good psychologist that work in tandem to make sure that I'm fueling enough for my body to fight my disease, and also just be able to support my body in order to stay active with a healthy amount of calories in my body. So for those of you who struggle with that, keep on going. Make sure you get in enough. And like every dietitian will tell you, it doesn't matter what you eat. You just need to get enough. You need to get enough because your body is an engine and it doesn't operate without fuel. And it's something I have to constantly remind myself of on a daily basis. Like if I get on the bike and I don't feel good, it's usually my own fault. It's because I didn't eat enough. So think about that before you head out on a 2-hour bike ride with a granola bar in your pocket. Talk to you guys soon. I'll check in next week. Okay, bye.